Retlouping. This is Bill, he's 27 and he's an OT by profession. Bill, can you run your hands down the front of your legs to try and touch your toes? Okay, Bill, and come on back up. What stopped you going further, Bill?
Tightness down the back of my legs.
Is that in both legs?
Yep.
Okay. Then we're going to place Bill on a bed and measure his hamstring flexibility. Stacey's going to measure Bill's hamstring flexibility. This is a standard way of measuring using supine lying, hip 90, and then extending the knee as far as you can. So you're going to use a goniometer. What do you feel, Bill, when she does that?
Tightness back of my knee.
Okay. We're going to flip Bill round and measure his other one. 50. Swivel round, Bill. Notice Bill's fully coordinated and knows he needs to swivel round on the bed.
This side is at 45.
Okay, so we're going to... And Bill, do you have any symptoms or pathology that you know of?
No.
No, so Bill's an asymptomatic 27-year-old male, we hope. And now we're going to do the procedure. So we've got two measurements, flexion in standing, and then we've got the hamstring measurements. I'm going to take Bill over to a wall and demonstrate the procedure. Starting position for a technique that has now been named Retlouping. So Bill is now going to start the procedure by flexing his head forward and then extending his neck. Can you tell us what you feel as you do that, Bill?
Nothing right now.
We've been using this
for a while. It feels like just like a relaxing underneath my legs by my hamstrings.
Okay. We've been using this technique in the clinic for patients with supposedly tight hamstrings, and also been using it on ACL reconstruction patients, and we've been discovering that we can regain extension almost from the first day that they visit the clinic. We've also used it on patients who've been having difficulty extending their knee post-surgically, and with one or two sessions of this procedure they appear to be able to regain full extension of the knee.
I start to get like twitching in my thighs.
Patients are often asked to do about 20 to 30 repetitions of full flexion extension, and then followed by rotation left and right to end range. Obvious precautions have to be taken for people who may have vertebro-basilar insufficiency in the cervical spine area, and this is done as a pre-screening test. The obvious questions of dizziness, nausea, drop attacks, double vision are asked prior to doing this procedure. What are you feeling, Bill?
Just that twitching in both my thighs.
That's in the front of the thighs or the back?
In the front. I don't have any tightness along the back of them anymore.
So when you started, did they feel tight?
Yeah, when I sat down, put my feet against the wall.
And then we're going to go up and down again. The procedure is generally performed 2 sets of flexion, 2 sets of rotation, and then we'll retest the patient's original baseline of flexion in standing and the hamstring length test. We've also discovered that you can do gentle extension mobilization of the knee in this position, and therapists have reported that they can almost feel the knee relax into extension and sag, and the patients have reported similar things.
That's about 25.
Okay, we'll come and stand you back up, Bill. Okay. Just going to get Bill so he's in camera view. Oops. Can you run your hands down the front of your legs, Bill? And come on back up. How does that feel?
Less tight.
Can we do another set? So it appears, even from just doing 2 sets, that Bill's gained around about 3 to 4 inches of flexibility with the flexion in standing test. What are you feeling in your legs, Bill?
feels tight to the back of my hamstring again right now. Twitching in front of my thighs.
What we'll do after this set is ask Bill to stand up and again do the flexion in standing test, and then we'll take him over to the bed and let Stacey remeasure his hamstring length. Once we've done that, I'm going to ask Bill to stretch his hamstrings, or use a hamstring stretch that's traditionally taught to athletes, and then we'll try and see what happens.
The tightness in the back of my legs is gone.
The original name of this test was Yes David, No David, but we've changed it to Retlouping for obvious reasons. Okay, and then just again, Bill, run the hands down the front of the legs to touch the toes. Good job. And then come on over to the bed, and Stacey will measure Bill's hamstring tightness, or length, or flexibility, whichever way we want to put that.